Why don't we get started? My name is Emily Novak-Castanis, and I am the president of the Medical Heritage Library, as well as the deputy director for the Center for the History of Medicine and the Countway Library, Harvard. On behalf of the MHL and its board of directors, I would like to welcome you to the first of our 4 talks in our inaugural spring speaker series. For those unfamiliar with the Medical Heritage Library, we are a collaborative digitization and discovery organization committed to providing open access to the history of medicine and health resources. Beginning in 2009, the MHL has aspired to be a research-driven history of medicine and health community that serves a broad interdisciplinary constituency. Today's event, like all those in the Spring Speaker Series, illustrates the rich ways the MHL corpus supports research. Before I introduce Nora, just a few housekeeping items. First, this webinar is being recorded and will be available online within the next couple of months. Second, if you have questions for the speaker, please enter them in the chat and I'll present them to Nora as part of the Q&A. Third, we'd like to extend our special thanks to Harvard Medical School for co-hosting this event. And finally, we invite you to learn more about our upcoming talks in this series. Descriptions and registration links are available on our website, medicalheritage.org. Next week's talk, Western Medicine in the Face of the Scourge of the Fevers of Bengal, will be presented by Tricia Halder. Now, I'm pleased to welcome Nora O'Neill, a first-year medical student at Yale School of Medicine. Nora is pursuing a combined MD, PhD in the history of science and medicine. In 2018, she completed her bachelor's degree from Harvard University in the history of science, focusing on the intersection of disability rights and reproductive justice. At Yale, she plans to study the social constructions of disability in medical and social activist spaces. As a physician historian, Nora hopes to engage in patient-centered care while also unraveling the historical complexities of the patient-doctor relationship. Her talk today is titled Carry On, the Depiction of Post-War Disability in Government Propaganda and Consumer Culture, 1919 to 1925. Please welcome Nora.
Hi, everyone. Thank you so much for joining me today. So let's get started. In Carry On, a magazine published by the United States Surgeon General and American Red Cross in the final years of World War I, images of smiling disabled veterans engaging in job training, physical therapy, and team sports spilled over the pages. In one story, 2 characters, the sluggard and the ant, appear together. After his arm is shot off, the sluggard tells us, "I cannot and I have not been able to do any work myself." He works his farm by telling his children what to do and believes injured soldiers should get pensions instead of working. By contrast, the ant has lost both his arms, but he says, "Of the left arm, I have a 3-inch stump, and you have no idea how much this stump helps out." He plows corn, cuts hay, feeds the hogs and horses, sows oats, and handles his own finances. And on top of that, he got married right after his accident. Though the fate of the 2 men is not mentioned, the ant ends the story with an offer of help to the sluggard and to any disabled veteran who wants to get back on their feet. The US fought in World War I for less than 2 years, but 200,000 military members returned home with a permanent disability. Though the sluggard and the ant were fictional characters, they represented the belief of the post-war US government that disabled soldiers could and should work to become financially independent. After the war, the US government set up standardized rehabilitation programs for the first time, aimed at returning disabled veterans to the workforce as quickly as possible. Disabled veterans had to enter these programs if they were to receive their life insurance and their pensions. The new programs emphasized job training, thus defining disability as an inability to work, to feed your family, and contribute to the economy. In addition, the interplay of disability-related stigma and patriotism in support for war veterans reformulated disability as a challenge to overcome, following the masculine ideals of independence, efficiency, and virility. In contrast, Previous efforts to handle the problem of disabled soldiers had been to place them in soldiers' homes, where they were supposed to live out their days, subsisting on their pensions, never truly returning to civilian life. This talk will consider the creation and execution of the federal rehabilitation programs from multiple perspectives. First, I'll examine the promises of the Surgeon General and the US government in the final years of the war, relayed through the programs themselves and the propaganda that accompanied them. Second, I will explore how popular writers and advertisers appealed to veterans in magazines like the American Legion Monthly, intended for the Veterans Organization. Third, I'll consider the perspective of the veterans themselves and their experiences of attempting to find jobs after they graduated from the programs. Disabled veterans made up every aspect of American society, wealthy and working class, Black and white, female and male. And yet, the image of the white male veteran with an amputation was at the forefront in government propaganda, popular media, and the veterans' own publications. Since the 17th century, American colonies had established pension programs for veterans to motivate enlistment. During the Revolution, the Continental Congress prioritized establishing pensions for soldiers who had been wounded in order to stave off the risk of resignations and desertions during the drawn-out war. This pension system continued mostly uninterrupted through the 19th century, eventually expanding not only to disabled soldiers, but to their families and to veterans whose injuries had occurred after discharge. By 1907, all Union veterans older than 62 years of age received pensions, regardless of injury. This indicated that the Civil War pension system had highly ballooned. By 1915, now attacked as gluttonous and corrupt, the pension system had exceeded $3 billion in total costs. As the US faced a violent conflict in Europe, progressive politicians weaponized the image of a disabled Civil War veteran as a helpless beggar living off government checks. They called for mandatory rehabilitation programs for all disabled soldiers. These programs had two goals that the government considered entirely aligned. One, to heal the soldiers who had sacrificed themselves for their country, and two, to invigorate the economy with the returning veteran workforce. The resulting 1917 War Risk Insurance Act mandated that all disabled soldiers who received insurance undergo medical care and rehabilitation. In addition, the 1918 Vocational Rehabilitation Act laid the foundation for intensive medical treatment and job training for disabled veterans. It created the Federal Board for Vocational Education, or FBVE, to oversee the vocational programs. The US government knew that in order to sustain a successful rehabilitation program, it had to convince not just the wounded soldiers, but also the American public that its definition of rehabilitation was legitimate and would result in healthy and satisfied veterans. Throughout the pages of the propaganda magazine Carry On, the messaging was clear. Disabled veterans could return to their lives as strong and capable as ever, as long as they made an effort. The creed of the disabled, which was emblazoned on many covers of Carry On, stated, "Once more to be useful, to see pity in the eyes of my friends replaced with commendation, to work, produce, provide, and to feel that I have a place in the world. Seeking no favors and given none, a man among men in spite of this physical handicap." The creed created the image of the perfectly rehabilitated man who inspired not pity, but respect, not because of his physical handicap, but in spite of it. Carry On promised that if the soldier completed his rehabilitation, he could once again become a man among men, as he was when he joined the military. For the idealized veteran, chance to work again was what he desired, not the fanfare that accompanied veteran celebrations, as seen in this cartoon titled, "When a Feller Needs a Friend." Here, the desire to work was intimately coupled with the image of the masculine veteran seen in Carry On. Within this coupling of rehabilitation and manhood was also the responsibility to provide for a family. Despite common fears of disability reducing a veteran's heterosexual desirability, the government did not limit its domesticity messages to able-bodied soldiers. The cover of one copy of Carry On depicted a pencil drawing of an attractive woman, her alluring eyes downturned, with the caption, "The best reason for reconstruction." Rehabilitated masculinity following disability involved not only financial independence, but also domestic bliss. A veteran with a wife and children represented a full member of society, one who provided for his family and raised future generations. In Carry On, disabled veterans were usually missing a limb, as depicted by this photograph of a man missing both arms who is learning to be a gardener. A common phrase used was, "From his neck up, a man may be worth $100,000 a year." Such a phrase aimed to redefine masculine value, not as physical independence, but as financial independence. Herbert Kaufman, a prominent American writer, elaborated on this phrase. How much of his body does a man need to earn a living in this year of wheels and wires? For instance, legs are not requisite at the cigar bench. Expert typewriters never look at the keys. A watchful eye of a supervisor is not hampered by the absence of arms. With intellect intact, amputees could undergo vocational training and emerge trained to take on jobs that had few physical requirements or provided equipment adapted to a missing limb. In this way, they represented the ideal rehabilitative candidate. Carry On did occasionally include other types of disabilities. For example, one soldier was highlighted as the first blind soldier to be rehabilitated. However, few other veterans with sensory disabilities were mentioned. Patients with shell shock were also included, but the emphasis on such soldiers that were experiencing post-traumatic stress disorder, as it will later be called, was that they appeared normal from the outside. One image of soldiers with shell shock was captioned, "Men who don't look it." Another, "Invisible wounds." Though perhaps not as easily as amputees who could hide a disability with an artificial limb, these soldiers could also be taught to disguise their disability and therefore show their readiness for the workforce. Other visually prominent wounds of war, such as facial scarring or the loss of multiple limbs, or the discussion of intellectual disabilities that were acquired during the war, did not appear in Carry On. In fact, veterans who were blinded or who may have exhibited the disturbing symptoms of shell shock were often placed in separate hospitals from other veterans, so as not to disturb the others. Vocational training aimed to retrain disabled veterans in various professions based on their past experiences and interests. However, the government warned that the program would only work if the veteran had the motivation and strength to undergo rigorous training. In Stick to It, Buddy, and Carry On, Private Colburn used colloquial language to engage his fellow soldiers. "And the last if, buddy. If I, at 35 years of age, with aches and pains all over me, without any previous education, if I can do it and win out, you can do it also. If," and here's that last if, "you really want to better yourself." Private Colburn's message was clear. Any man who joined the army and was injured could be rehabilitated, but only if he wanted it enough. This message, though seemingly positive, absolved the government of any soldier's failure, for it could argue that the soldier had not tried hard enough. Like the government, American popular media urged disabled veterans to re-educate themselves and return to the workforce. In the final years of the Great War and through the 1920s, American magazines were filled with illustrations and stories of veterans, perpetuating the same image of the strong male veteran seen in government propaganda. In fact, Many big name advertisers got their start in wartime propaganda work. As magazines increased readership by the thousands, advertising men were highly aware of veterans as a prospective audience. In magazines written for veterans, advertisers appealed to them as a distinct group of consumers. They drew on assumptions of what veterans desired once they returned, such as a new job or a family home. Advertisers appealed directly to the perceived masculine bravado of veterans, even when promoting seemingly unrelated products. An ad for breakfast cereal in the American Legion Weekly described, "Golden brown cornflakes, the kind that wins the confidence of red-blooded men." Some advertisers assumed that veterans were proud of their war service and wanted tokens of the war. One advertisement described a lamp, nicknamed Uncle Ed. It was formed out of a 75mm shell and a helmet as a lampshade. The advertisement personified it as a soldier. "He stands as straight as a buddy on parade, and he's as firm and solid and unshakable on his feet as an American soldier meeting attack." Beyond the likely unintentional phallic symbol of the lamp, this advertisement expected veterans to want to own and see a constant reminder of their service. The lamp served as a symbol of the masculine power that veterans supposedly possessed, both in war and peacetime. Although such advertisements appealed to all veterans, those aimed at disabled veterans perpetuated the image of the hardworking disabled soldier. Magazines like the American Legion Weekly were filled with advertisements for trade schools, how-to books, and professional training camps. In many, like this electrician training ad, the familiar phrasing of "from the neck up" seen in government propaganda appeared. "Wishing is never going to make your dreams come true. You've got to study, to learn. A man is worth $2 or $3 a day from his neck down, and no more. But there is no limit to what he can be worth from his neck up." Amplifying the government's messages, advertisers saw disabled veterans as men who could be lauded only if they endeavored to become workers and consumers again. Though most advertisements did not depict disability directly, a few promoting prosthetics and other aids were sprinkled throughout these magazines. One, which sold artificial eardrums for deaf soldiers, declared, "They are perfectly comfortable. No one sees them." An ad for C.H. Hittenberger, a firm that sold artificial limbs, wrote, "Before placing an order for your permanent artificial limb or whatever you need from our line, send for catalog." In both of these advertisements, the emphasis on invisibility of the disability was clear. The artificial eardrums, which enabled the wearer to hear perfectly, could not be seen by others, while the artificial limb imperceptibly replaced the missing one. Other advertisements referred to the time before the war, such as for the St. Francis Hotel, the scintillating rendezvous of society today as it was before and during the war, or Rainier beer, the same old flavor, the same old taste. The message was clear. The war may have caused permanent disabilities, but the nation and its citizens were returning to peacetime with no room for reminders of the violence. Clearly absent from the imagination of the advertisers in popular magazines were Black veterans. The few depictions of Black people in the American Legion Weekly were not actually of Black people, but instead of white people in blackface. One advertisement for saxophones declared, "Be the Tom Brown of your town," with the image of a man in blackface holding the instrument. This was a reference to the white musician Tom Brown of the Six Brown Brothers Band, who performed in blackface. Ignoring the many Black veterans who were fought and were wounded, popular magazines of the 1920s depicted a very specific image of the disabled veteran. A white man who was proud of his war service, sought to heal or hide his disability, and contributed to the economy as a worker and a consumer. The American Legion, the largest veterans organization founded in 1919, declared that the previous corrupt pension system had not helped the veteran, as they said, to become again a producer. In addition, the Disabled American Veterans of the World War, or DAV, was founded in 1920 specifically to advocate for a better pension and rehabilitation system. Veteran interest groups demanded that the lofty promises of rehabilitation be fulfilled by the same government that had put them in harm's way. In a 1920 cartoon in Life magazine, the blinded soldier gropes forward, looking for the way to a job and a future, while petty clerks and government officials call to him in a perverse game of blind man's bluff. The veteran's one leg is wrapped around a taut telephone cord, indicating his inevitable fall. This cartoon depicted the many frustrations that disabled veterans faced as they attempted to take advantage of what the government promised them. The American Legion was vocal in its criticisms of the Federal Board of Vocational Education, or FBVE. In American Legion Weekly, Marquis James, later a Pulitzer Prize winner, began with the story of Robert Lee Hardwick, who returns to his family confident that he will find a job again. Bob Hardwick kissed his wife and baby with a smile and told them not to cry. Dad had only done his bit, as should any man. And as for the gimp leg and the bum eyes, Uncle Sam would take care of all of that. The old railroad job may be gone forever, but there were other ways of making a living. Uncle Sam would see to that too. Hardwick wanted to learn to mend shoes, but faced delayed applications and limited classes. He was told to try bookkeeping, but ultimately fell to the bottom of his class and quit. James wrote, "There are at this writing some 1,100,000 Bob Hardwicks." The FBVE had failed to connect disabled veterans to suitable jobs and even neglected to reach out to newly disabled veterans in the first place. This argument was in direct conflict with the government's claim that it provided the necessary training, but lazy veterans were the ones at fault. By the end of the war in 1918, the Bureau of War Risk Insurance proved unable to handle the influx of pension claims, and the head of the Bureau faced charges of embezzling large amounts of funds. In addition, most disabled veterans, after completing their medical treatment, abandoned the careers picked out for them. The FBVE outsourced nearly all training to private trade schools, universities, and businesses. After little success with private training, the Veterans Bureau, which is now called Veterans Affairs, and it was founded in 1921 to consolidate multiple agencies. They created new federal vocational schools. However, with lack of funding, most federal vocational schools closed within 2 years. In a report to Congress, the FBVE even admitted that convincing employers of the nation to hire disabled veterans was a gargantuan task. Many employers preferred able-bodied workers over disabled workers and refused to provide accommodations. In addition, new workmen's compensation laws, which required employers to give pay to employees injured on the job, were another deterrent, with the assumption that disabled workers were more likely to injure themselves. There were a few instances of businessmen and industry giants calling on their fellow employers to give jobs to disabled veterans. A major American architect, Albert Klahn, declared, "The labor required for reinforced concrete work is largely unskilled. Even the maimed and crippled soldier may be made use of." However, his language indicates a different view of the disabled soldier than the FBVE had. Rather than a skilled worker making up for his handicaps, Kahn saw disabled veterans as only able to do unskilled work that required no training. Despite Kahn's hopes, few vocational programs offered training in architecture or construction. Although Marquis James had argued that much of the fault lay in the inadequate practices of the FBVE and Veterans Bureau, he also saw societal discrimination at play. Veterans faced discrimination by business owners intolerant of physical and emotional differences and concerned over potential liability. Although government propaganda insisted that any disabled veteran who underwent its rigorous vocational training would find a fulfilling, financially sound, and suitable position, the veterans themselves saw that this was not the case. Although both men and women and people of diverse races and ethnicities fought and were wounded in World War I in the US military, missing from the pages of Carry On and the American Legion's magazine were any depictions of veterans who were not white and male. Around 2,000 women returned with service-related disabilities. Their absence in propaganda is striking, particularly because veterans organizations like the American Legion welcomed them. The American Legion supported a group called the American Legion Auxiliary, a women's group dedicated to both female veterans and the mothers and wives of veterans. However, in government publications, women were only shown as caregivers for wounded soldiers. This photograph from Carry On shows women preparing their teaching materials for blinded soldiers. The caption reads, "Without the tactful, intelligent help of women, Reconstruction would not get very far." The women sent their men off to war and then welcomed them home. And yet there were women that joined the battle too, returning with disabilities. Rehabilitation was not designed for them, with no mention of women in the hospitals or job training programs, and the propaganda reflected this. Even more striking was the lack of Black soldiers included in government propaganda, even though almost 380,000 Black men fought in the war. In addition, some rehabilitation hospitals were integrated with Black and white soldiers lying side by side, but none of them appeared in the photographs in Carry On. In Carry On, there was only one story of a Black veteran. However, his story sharply contrasted with the strong, capable white veterans who just needed some assistance to return to their former strength. He was described as an ignorant Negro, a private, and all that was known of him when he landed in the debarkation hospital from the transport was that he was deaf and dumb, sick, deeply depressed, semi-hysterical, and practically mindless. None of his own perspective in experiencing rehabilitation was included. The story is limited to a nurse determining he was deaf, not mentally defective, and thus his disability could be fixed. His race, along with his decrepit appearance and deafness, were emphasized to indicate that the government could fix even what it would consider the lowest of society, a person it described as mindless. Although both women and Black veterans were wounded in the war, and some were even treated in the rehabilitation programs, these programs were not built for them. This resulted in even less success than the white male veterans who did fit within the government's one-size-fits-all training. Overwhelmingly, government propaganda and popular culture painted these 200,000 veterans as a monochrome picture. White men who were injured, treated, rehabilitated, and given a job to support their family. Like the aunt from the story, the hardworking veteran cheerfully submitted to the doctors and nurses to treat his injury, underwent vocational training in a career he enjoyed, and returned to the workforce. On the other side, the sluggard was the disabled veteran who despaired, choosing to live off his pension and blaming his government for his lack of employment, rather than his own lack of work ethic. This binary outcome did not acknowledge the diversity of identities, experiences, and types of disabilities among the many people who became disabled during the Great War. Though masculinity during war meant physical strength and valor, rehabilitation propaganda and popular media shifted it to a focus on economic independence and domestic family life, ideals that could supposedly be achieved by all male disabled veterans. Popular media embraced this image, moving away from depictions of so-called crippled children to be pitied to patriotic veterans who were independent and deserved respect. And yet these rehabilitation programs failed for many. We can sense the frustration experienced by growing numbers of disabled veterans in the 1920s and 30s when they joined the so-called bonus army in Washington, D.C. in 1932. Thousands of Great War veterans descended on the National Mall to demand faster processing of their financial bonuses to stave off economic collapse. The government had created the expectation that all veterans could rejoin the workforce and make a living, and yet these dreams of economic independence were dashed, not due to the veterans' shortcomings, but to economic issues out of their individual control. Driven out by the military after a month of camping in DC, the veterans left empty-handed with no jobs and no bonuses. By coupling financial independence with masculinity, the government had created a crisis for these veterans. Not only were they blamed for their inability to get a job because of supposed laziness, they also had few opportunities to provide for themselves and for their families. Some disabled veterans joined the League of the Physically Handicapped, an early disability rights group. It was founded in response to New Deal policies, which discriminated against disabled people for job placements. Understanding the government's far-reaching message of economic independence for disabled veterans is imperative to understanding the crisis of American masculinity during the Great Depression and the early roots of the American disability rights movement. The emphasis on work ethic in government rehabilitation redefined independence as financial rather than physical. This change was little more than a slight shift. It still centered masculinity in power and self-efficacy. Popular media also expected disabled veterans to return home unchanged, forcing them to hide their disabilities and carry on. In addition, the one-size-fits-all rehabilitation and vocational training could only help certain types of bodies and did nothing to combat rampant discrimination once the veterans left the rehabilitation centers. Though the post-war period made room for shifts in the relationships among disability, masculinity, and independence, the government and American popular culture's reliance on masculine ideals limited the possibilities of understanding disability as a social identity with a history of discrimination and neglect. With the transformation and popularization of rehabilitation science following World War I, came a rehabilitation of the meaning of disability, but only for a few. Thank you very much.
Thank you so much, Nora. That was great. We do have a couple of questions coming in. I'd like to remind folks that using the chat function is the way to submit questions for Nora. So first question, how long was Carry On published after the Great War and what was its circulation?
Yeah, definitely. So Carry On was actually quite short-lived. It was sort of, it began right at the end of the war. So like in September 1918, which the war ended in November 1918. So, it was only around a little bit during the war and then continued on for another year. So it definitely was not a long-lived magazine. In terms of circulation, it's actually kind of hard to tell. There wasn't much in the archives about, how far the readership went. It definitely was circulated in rehabilitation hospitals. So sort of the assumption was that mostly disabled soldiers were seeing it while they were in their medical treatment and rehabilitation. It also was circulated to the families of these veterans. So sort of the thought was that the main readership would be the disabled veterans themselves along with their loved ones.
Did the UK or France have a publication similar to Carry On or similar rehabilitation programs as the US, given the much higher casualties they experienced in the Great War?
Mm-hmm. Yeah, that's an excellent question. So actually some of the rehabilitation science that US doctors were working on was actually borrowed or sort of worked upon from British and French rehabilitation doctors. So this was definitely a period in which, pretty much all of the players in the World War were working on different ways of rehabilitation science. And I think it speaks to sort of this changing idea of disability as, something that can be treated rather than something that would sort of mean that you would just have to enter a soldier's home or a group home and live there the rest of your days. So there were similar hospitals that were done or that were set up in Britain and France as well.
Great, thank you. This next one says, great talk. Thank you. I have a reference and a question. The reference is Paul Lowry, University of Winnipeg, who has written about African-American veterans and Carry On. And so I'm just I guess an FYI, that's an interesting resource. The question is, and having gone through Carry On for my own research, I kept noticing the phrase make good. For example, first blinded soldier, he is being re-educated and will make good. What did the men need? What the men need is an opportunity to make good as straight citizens. Given your deeper dive into this, what all do you think is contained in that phrase, making good? That's not a phrase we use much today, and it seems to go beyond getting a job, re-entering society, etc. Something very American. Your thoughts?
Yeah, no, I also noticed that phrase as well. And it was something I wanted to comment on, but didn't have space for. So to speak also to the Lowry piece, that was definitely an excellent source for me when I was really looking at sort of what was happening to Black veterans during the war and after. So yeah, for the phrase make good, I think it's really interesting because it was sort of speaking to the fact that these rehabilitation programs were not just meant to heal the veteran's disability, or at least sort of help them to adjust to a disability, but also to figure out what they could do beyond the time that they were in the veteran's hospital. This idea of, being able to get a job and contribute to society wasn't just limited to them being able to support themselves financially so that they didn't have to live off of government pensions, but there was also this idea of they needed to contribute to society. Like they couldn't just be sort of a neutral source where they were able to, get a job, pay for, their food, for their home, for their family, but also to be able to contribute to the economy outside of that. So whether that was being a consumer, which we saw through all of these advertisements, but it was also actually, providing good work, like making good. Like, for instance, there were actually a couple of articles within Carry On that talked about sort of the goods that disabled soldiers would make while they were in the hospitals. One article focused on making toys for children. And, this was something that both worked as rehabilitation because it involved using your hands and sort of fine motor movements and a way to pass some time while, being stuck in the hospital, but also for creating toys for children in Europe who, who had lost their homes, had lost their own toys. So it really speaks to this idea of, getting a job was not just about being able to support yourself, but also being able to both, consume American products, but also doing something that contributes either to the economy or to your community, rather than sort of just being left alone because you have a disability.
Wonderful presentation. Were there any differences in how soldiers and sailors were rehabilitated and expected to return to work?
Yeah, that's an excellent question. So I would say I don't think there were major differences. Most of the rehabilitation hospitals were sort of military wide rather than branch specific, but that's definitely something I will have to look into. So my initial thought is no, but that's definitely something I will want to look into later.
Great. Here's another comment. Thank you for the wonderful presentation. If the publication was circulated to families, what role did wives play in encouraging their husbands to rehabilitate themselves according to these specific ideals? Did the magazines address them directly?
Yeah, that's an excellent question. There were multiple articles within Carry On that specifically addressed the women in the lives of the disabled veterans. And as I mentioned, that's really only the discussion of women in those magazines. There's really nothing about female veterans or female disabled veterans. So, sort of the messages that were being sent by the government to the wives and, even to the children of these veterans was that they can't be rehabilitated without your help. You have to be the one standing by them, supporting them, whether that means emotional support or even help with the exercises that someone may have to do to sort of work on their atrophied legs. Or, just kind of providing them the kind of support that a wife supposedly should provide, like, providing meals and a safe home. So really the message was that, yes, women had a role in rehabilitation, but it was really just as a supportive role. And there wasn't much talk at all about, what happens if a woman returns back from the war with a disability.
Were there other soldiers with disabilities pictured in the images or eligible for services other than those with amputations or those who were deaf?
Mm-hmm. Yeah, so there were images of soldiers with a variety of disabilities. I would say the majority were of people with usually a single amputation. The other thing that's interesting is that of all the images, they're very cheery. There's no sort of grotesque images, nothing that is supposed to sort of scare the veteran or the wife or the family member who's reading the magazine. And in fact, often, the disability is hidden. So for instance, one of the last images I showed of the soldiers working on making toys, their blankets are covering their amputated legs. So for the majority, most of the photos were of people missing a limb. However, there were mentions of soldiers who were blind and soldiers who were deaf. As I mentioned as well, there were soldiers who were experiencing shell shock, or what we now call PTSD. So there was a variety included. However, there was such an emphasis on this idea of rehabilitating someone with an amputation throughout the articles. So, there was a focus on how do you wear an artificial limb? What kind of physical therapy do you have to go through when you're missing a limb? What kind of jobs are available to you if you're missing a limb? So, as much as there was some representation of other types of disabilities, there was a huge focus on the people with amputations.
I'm going to just skip one question and come back to it since it seems germane to what you just said. Was there a role, what was the role of prostheses manufacturers such as A.A. Marks? What role did they play in promoting self-sufficiency of wounded soldiers? And, I'm assuming speaks to some commercial ties between.
Mm-hmm. Yeah, there were definitely a lot of commercial ties. One thing to note is that Carry On did not contain advertisements. It was really purely a sort of propaganda magazine. But there was a lot of focus on sort of partnerships with manufacturers of artificial limbs with the government. So there was a lot of focus that the government and the rehabilitation doctors that were working with the government on sort of finding the best artificial limb. And the things that they were focusing on were mainly appearance. They were really looking to see like what kind of limb looks almost like a normal limb, quote unquote, a normal limb, but also comfort and also ease of using it. So there was, again, it was really about finding an artificial limb that appeared like a normal limb, but also could work as sort of a permanent replacement, something that a disabled veteran could wear day in and day out on their feet or not on their feet. And really just a way to kind of hide their disability, which, as we have seen, in the past like 10-ish years, there have been a lot of veterans who have returned back from Iraq and Afghanistan with amputations. And it's really interesting to see how advances in sort of the science around artificial limbs has kind of gone away from focusing on the appearance of it and really on the utility of it. So, you know, for instance, if you see someone running, say, in the Olympics who's missing a limb, often their artificial limb looks nothing like a foot and a leg. And they're really focusing on rather how it works rather than how it appears. So, you know, there was a lot of focus on, you know, multiple different manufacturers about competing to find this perfect limb that looked perfect, rather than so much the function of it.
You mentioned the precedent from the Civil War reconstruction for these constructions of disability. Were there other influences that you found on the perspectives placed in Carry On from Western pioneering, colonization, for example?
Mm-hmm. Yeah, that's a great question. Yeah, I think that question speaks to sort of all of the influences of what sort of created this definition of disability, which, you know, we could have an entire talk on disability history. But there has always been a like very sort of insidious influence of colonization and of slavery on the definition of disability. There's a lot of wonderful work in this area that I'd highly recommend looking into. You know, that essentially it's the question of how we define a quote unquote normal body. It's how we define what moves away from the norm. And, you know, there has been a lot of arguments that with slavery within the US, that there is sort of this redefinition of what, you know, an enslaved body looks like versus what a not enslaved body looks like. And so a lot of that is sort of the focus on being able to work, which is sort of what I was talking about as well with this, is that often disability is seen as an inability to work and an inability to contribute to a society. And so, you know, it could be something as minor as like, say, you know, someone who has narcolepsy and is unable to stay awake during the day, all the way to, you know, someone who has pretty severe intellectual disabilities and unable to contribute. And, you know, what's really interesting within disability studies is this argument that disability does not have to be defined that way, that it can be defined as a social identity, as, you know, a group of people, a very diverse group of people who have experienced discrimination because of, you know, the differences that they may possess within their bodies, within their minds. And so, again, like the way that disability was described at the turn of the century was really this focus on work. And as you mentioned, like with Western pioneers, you know, I could see that working there as well. Like there is this emphasis on work ethic and continuing to move forward, and sort of the need to challenge yourself. And I think, you know, disability was kind of considered the opposite of that, which, you know, as we've seen over the course of the years and through the disability rights activists who have been very vocal in our country, is that, you know, disability does not have to be defined in that way.
Thinking of that continuation post-World War I, in what ways do you think this white male-centric one-size-fits-all system reflected in disability services provided by the US government persists today? Is the messaging still there? I was particularly interested in to follow up on this question, like after World War II, did we see the same thing?
Mm-hmm. Yeah, I think that I can sort of narrow that question to talking about rehabilitation science, which even today very much focuses on, you know, sort of the ability to work. You know, there's something that that people within rehabilitation called activities of daily living, which, you know, can include being able to brush your own teeth, being able to make meals for yourself, being able to go to the bank, to the grocery store. And, you know, that kind of stuff is related to sort of your own, you know, personal life, your personal hygiene, that sort of thing. But there is also a focus on rehabilitation even today about, you know, I have a job, I'm recently disabled, how do I work through that system? How do I figure out how I can continue with this job, or how do I find a new job? And I think a lot of it just has to do with how capitalism works within our country. Like it's very difficult to, be able to take care of yourself unless you have a job, are employed. One of the major issues within disability rights today is, often people who are on unemployment, do want to work, or may, like with a disability, may want to work, but they can't get off of unemployment because they need something to sort of support them. And so I think, again, there's just still a lot of focus on this ability to work, rather than on thinking, are there alternative ways that, someone could support themselves beyond having sort of a quote unquote like 9-to-5 job or something like that. To your question about after World War II, definitely rehabilitation really got its start after World War I within the US because of these sort of centralized systems. And that was definitely continued after World War II.
We have just a couple of more questions, which I think works really well for the time. We have about 7 more minutes. Can you talk about what was expected from shell shock veterans? Did you find any information about what their employment outcomes were like?
Mm-hmm. Yeah, so unfortunately, most of the reports that the Federal Bureau for Vocational Education included didn't actually separate out people like in their statistics by disability. They did separate it by men and women, which does indicate to us that some women were in these programs, even if they weren't actually represented in the propaganda. So in terms of their expectations for the patients who experienced shell shock, it was very much about hiding their disability. This idea of what one of the pictures of them said, they called them invisible wounds, like the idea of shell shock being invisible only to the person experiencing it, actually being able to see it and to feel it and to express it to the outside world. So, this idea was that shell shock was something that was supposedly easy to hide, that you could act normal, you could assimilate yourself back into society because, you weren't missing a limb or you didn't have scars. Everything was internal. And, it was kind of this idea of just tamping down all of the emotional dysregulation and the emotions that you were feeling and just kind of reassimilating back into society. So yeah, there wasn't much discussion of sort of the therapy work that was happening just yet.
All right, finally, do you have any insight into who wrote for Carry On? Were any of the authors previously engaged in covering the war?
Yeah, that's a great question. So many of the writers of the Carry On were actually employed by the government. So there weren't many like reporters, people who had been sort of reporting for newspapers about the war. Many of the people were actually government officials that were organizing the rehabilitation programs in the hospitals. So for instance, Douglas McMurdy, who he ran actually one of the original hospitals for disabled veterans pretty early on in the war. He wrote often for it. So it was a variety of government officials. And in fact, it's unclear if any articles were written by veterans or disabled veterans themselves. Most of the articles that were written from the perspective of a veteran, there was usually a little line that said this is fictional. So as I mentioned, the story of the ant and the sluggard, which is kind of this comparison piece of a veteran who's able to redo sort of his whole life, even though he's missing both arms, versus the sluggard who, just wants to live off of government checks. That was completely fictional. And there were multiple other stories like that where a veteran says, like, look at me, I was able to get a job, like, even though I lost an arm. So, it's unclear, like, if there were any actual perspectives of veterans included.
I think that with that, we will thank Nora for her talk today. Really great questions. Thank you so much to the people who attended and submitted those questions. And I thought it was really just an engaging session. Just a reminder, our next spring speaker series will be on April 2nd, which is next Friday from 12 to 1 with Tricia Heldar, please visit medicalheritage.org for more information and to register. Thank you so much. And thank you, Nora. We really appreciate it.
Yeah, thank you so much.